Assalamualaikum doctors. In this video I am discussing about autism. So autism, communications, development, everywhere it comes. We are seeing the triad. Remember what are the problem in autism occur? Social communication, social imagination and social interactions. They have problem. So autism for medical student or mothers both come. I just here discuss about autism for medical student. First I am telling the features. Not before 3.5 years age. Remember, after 3.5 years age. Speech verbal like delayed speech, they have echolalia, scripting, no active conversation. Then speech non-verbal like no facial expressions, no eye contact, no pointing and no need expression. Social and no social response, no emotional response, solitary and tantrum. Repetitive are like steaming, rigid routine, obsessed with one toy and obsessed with a part of toy. Now, autism definition is that it is a spectrum of lifelong developmental condition affecting different four areas: social, communication, behavioral, and sensory processing. So, it is a lifelong condition. 4 years: social, communications, behavior, and sensory processing. What did you observe in Ali yesterday? Suppose he's Ali. I observed the problem in the communication. Excellent. Adding to this, he may have social, behavioral, and sensory processing disorders. Do you have any idea about this? Okay, so sensory processing disorder, what is that? It is an unusual response to sensory stimuli. For example, exaggerations of frustration if he hears hair dryer, frustrated or gags if he smells abnormal smell. If you just touch him, he may be frustrated. So this is the sensory processing disorder. What are the investigation we do and management we do for autism? So the investigations are like questionnaire method done by the GP to decide if he needs to be referred or not to the autistic team. Autistic team will be do the DISCO. DISCO is the diagnostic interview for social and communication disorder. Number 2, observation by ADOS. ADOS is the Autistic Diagnostic Observational Schedule, making observations for communication and playing as a part of social. Then examination, full developmental assessment and the help. Fill different parts from different categories. 3S. First of all, school. School will be contact with the educational psychologist because if he has any observation in time of lunch or the break. Severity scale is to determine how he depends on himself and what type of school he needs. Then specific associations are we need to know he is isolated or part of syndrome, as it may be associated with the ADHD or any symptoms. Now I'm going for the management. SOS. SO is that first of all specialist, refer to autistic specialist. Okay. Number 2, occupational, to improve the daily normal activities, stressing on FDPT, that is feeding, dressing, play and toileting. 3 is speech and 4 is school, educational healthcare program. Treatment is directed to area of defect, multidisciplinary team with autistic specialist on head of team. If educational problems has 2 ways: parents interview program and educational healthcare program updated annually. Then if communication problem, then cognitive behavioral therapy, talk therapy to change and improve the way of thinking, including the psychologist and sometimes the psychiatrist. Then applied behavior analysis and therapy. If sleep disturbance or aggression, will need medications. If any association with autism, manage it. So autism with manage it will be do this. So do you think I am autistic? First of all, we discuss how to diagnose autism. You remember? Yes. So we could not diagnose autism with one autistic features. We should have different multiple signs at different areas. While I'm talking to you, I notice that you are speaking well. I do not notice that any behavior or sensory problems. Any one of us may need some time to be alone. So I do not think you are autistic. Any rule for diet? This is still under research. There are some multiple studies on that, but still no proof for that. We are waiting for confirmations. If there is evidence for that, we can use it. Any rule for medications? There is no rule, but if abnormal behavior like sleep disturbance, aggression or specific other associations. Any blood test needed? Actually, no. So this is all about the autism, which is we diagnosis after 3.5 years of age, and they have the problem in 4 areas, that is speaking, communication, behavior and sensory processing. Social, communication, behavioral and sensory processing. And the treatment is mainly cognitive behavior therapy, occupational therapy, psychology, psychiatrician. These are no treatment, medical treatment not needed. If there is sleep disturbance, aggressive, self-harm, then we can do that. Otherwise, no test also not needed, investigation not needed. Thank you.